Okay, so at your 1 week post-op, we're going to have the contact lens removed. It's delicate, so when the lens comes out, please don't rub or squeeze. You might cause the skin of the eye to come off, and then we have to do it all over again, okay? So just be careful. You're going to be stopping your combination drop. Just use it one more time that night after the lens gets removed. Then you switch to the steroid drop. Follow the steroid drop directions exactly. I hate it when we tell the patient to do it 3 times a day and they do it 1 time a day. They're going to screw up their vision. Just don't do that. It's not that hard. Let's say it's 3 times a day for a month, then 2 times a day for a month, then 1 time a day for a month. That's it, okay? Take all your medications and refill them until the next visit. We hate it when the patient's like, I was told to do it 2 times a day, but I ran out, so I stopped. No. If we tell you 2 times a day, it means until you come back. If you run out, you refill it and you keep doing it 2 times a day. That's the default instructions. Now, rarely we might say just run it out, but that's really not going to be until like your 1 month or 2 month visit. You have to make sure that you understand that you're not going to get your best vision for a while, but you get most of it soon. I just don't like it when the staff keeps saying, oh, you're not going to get your best vision for 6 months. It's ridiculous. That means you think that you're going to take 6 months to see well. No. You're going to get like 90% of your vision in the first couple weeks, and then it's going to be slow improvements, okay? So just again, keep your eyes closed as much as possible and lubricate as frequently as possible to see as well as possible. If you have double vision, you have to use the ointment 3 times a day, not once a day. If you feel that you're overcorrected, we're going to talk about the overcorrection on your visits, but if you're overcorrected, we'll stop the steroid very quickly and maybe start a non-steroidal drop. Try to take your drops, small drops. Just push the bottle gently so you have small drops. If you push it hard, you're going to waste product and you might just overdose yourself. So just push the bottle gently so you have small drops. If you have dry eyes, we're going to give you a prescription medication. There's several of them for dry eyes. So if you're dry, just tell us you're dry. If you're tasting the steroid drop, you have to tell us and we have to recauterize you. If you're not coming in for a couple of weeks, you could do manual punctal occlusion. It's basically just, holding the corner of your eyes shut. There's a little mound of tissue and it closes off the punctum. So just Google manual punctal occlusion and that's what we'll do if it's a couple of weeks before you come in. If you have a question and you're going to come in the next day, please don't text or call. Just ask us the next day unless it's some big emergency because it's just not efficient. We'd have to pull your chart, get the doctor review it. It doesn't make any sense. Just ask us the question when you come in. On the other hand, when you leave the office, please don't not read the directions, not read the instructions, and then leave and then call us back. It's just not efficient. Just read your instructions. By the way, you should be getting your instructions on the front desk before you check in. Don't rely on the front desk people to give it to you. They get busy, they forget. It's ridiculous. They're sitting on the front desk labeled 1 week out, 1 month out, 2 months out. They're called stage directions. It's what stage you're at. Just take it yourself. You have to read it before you see the doctor. Don't put it in your purse. It's got all the FAQs that patients typically ask. You read it, you're informed, then you don't have to ask your basic questions to the doctor. It's a waste of time. You can ask them your specific questions. Get the stage directions from the front desk yourself every visit, read it before you see the doctor, and then you could ask the doctors your specific questions. At checkout, it's very important that you take a picture of your directions. It's very important that you put the appointment in your phone about when to come back. We stopped doing reminder calls like years ago. You're going to get a reminder text message and email, but please be responsible and pay attention about your own appointments. If you have any questions and you don't see me and you want to see me, you are allowed to see me. If you're doing great and perfectly, you're not actually able to come on a day that I'm here because those days are reserved for the patients with problems, okay? So if you have a problem, just tell the staff, I'm not seeing perfectly well. I want to see Dr. Chin on the next visit. Even worse, sometimes you're in the office, I'm in the office, you want to see me, you don't tell the front desk person or the fellow. They don't have me see you and you think I don't want to see you. It's not true. Anytime that you want to see me, I'll see you, but you have to be very clear with the staff and say, it's fine that I saw Dr. So-and-so, the fellow. I just want some reassurance for Dr. Chin. And if I'm in the office when you're in, you're supposed to be kind of seeing me because otherwise you shouldn't be in. So again, the rule is if you're doing perfectly, you're not allowed to come when I'm here because that is reserved for the patients who aren't doing perfectly. Just remember that as a rule. That's pretty much it. If you want a WhatsApp group, we can make a WhatsApp group for you. It's a good way to keep in touch. We don't do that routinely anymore, but if you have an unusual prescription, unusual condition, keratoconus, cross-linking, high prescription, going out of state, All these things, we're usually making WhatsApp groups. You might need to remind the staff to do so, and that helps everything stay on the same page. That's pretty much. So just make sure you follow all the directions, read all the directions, and you'll do great. Thank you very much.